write in your comments so we can plan for our next one. So Gigi, I'll pass it to you for the next part.
Thank you so much, and thank you so much to our panelists. We are so appreciative, and we're going to jump right in. We've got so much to cover. There's a million things to cover. In fact, that's one of the things that I learned from both being in school and from the web that has no weaver, which is you could study this for 80 years and still be scraping the surface. So thank you all for being with us for that first panel. And we're going to jump into our next panel, which has to do specifically with how acupuncturists treat opioids and the opioid epidemic in America. And we have wonderful panelists that are joining us. We have Professor Jacquelyn Byrd and Dean Joanna Chao and alum Adrian Dougherty. And I don't even want to spend too much time introducing each one. They're all very accomplished and I want them to speak for themselves. So let us say that Professor Jacquelyn Byrd, we're going to begin with you. She is a professor at Five Branches and actually does quite a bit with the opioid epidemic. She treats on her own and in Santa Cruz County and in sort of a more, in a different aspect, and also teaches. And we have with us Dean Joanna Chao, who will speak just after her. And then my friend and colleague from my school days, Adrian Dougherty, who now works alongside many different practitioners treating the opioid epidemic in Philadelphia. Go ahead, Professor Byrd. I know you've got a lot to share with us. Please jump in.
Sure. Hi, everybody. Nice to be here this evening with you to share with you, talk about TCM role in U.S. healthcare, as well as how we go about treating our patients who have been on opiates, who are trying to come off of opiates, or are finding alternative therapies to try to relieve their underlying situation, contributing to the reason for opiate use in the first place. So Alex, I think I have a couple slides here that help me stay focused on what I want to say, and I won't be long-winded here, so just like to give you a feeling for what we do here. Sadly, I can't see that very well. Okay, but anyway, okay, there we go. Thank you so much. And maybe I need different glasses, so I'm going to do that. You can go to the next slide. All right, so maybe I look a little more intelligent now with these glasses as well. All right, so I want to talk a little bit about how we as practitioners here in the US go about taking care for our patients in a holistic, integrative manner to work with those who have been on opiates. And quite frequently, we get referrals from other physicians, other doctors, to see people who have conditions of pain or chronic diseases, and sometimes behavioral health issues. But those patients also are taking opiates. Or we may get a referral to see certain patients because they want to decrease the patient's opiate use or reduce their use of pain medications in general. In some cases, the trend has been to not prescribe, not refill opiate medications. So how do we treat patients in those circumstances? So we often integrate very closely with other practitioners, sure, of course, other TCM providers, as well as Western providers, as well as their therapists, try to give a holistic, complete approach to support our patients who are dealing with various issues. In Santa Cruz County, we have acupuncture specialty clinic. I'm the lead for that particular clinic, where we bring acupuncture in to help the full spectrum of Chinese medicine to help patients with various health issues. This allows us to address health disparity, meaning providing this complementary or alternative medicine to people who aren't necessarily gaining access to it, treating different problems, including, I'll call it, substance abuse disorders. And that is a quote from Santa Cruz County. So they said to me, hey, Dr. Byrd, remember, we don't want to say addiction. we really want to say substance abuse disorders. So people who have issues with opiates, alcohol, maybe food, not the most important thing for this discussion here, although it certainly is an aspect of it. So what are we going to do? You can go to next slide also, Alex. So certainly when we see our patients come in, we take a look at their profile, their patterns. How do they present? What issues are going on? We absolutely take a look at their charts. I'm working in an integrative healthcare system where I'm using electronic records. I'm looking at referrals from the doctors. I look at the radiology reports, some of the lab reports. Yes, that Western information absolutely can get folded into our understanding of the patient in a modern U.S. healthcare system. And then I proceed to evaluate them from a TCM perspective, of course. And what can we do? So we look at their patterns, we look at some of the issues that they're dealing with. Let's say pain, an easy one enough, is a part of the issue why they were on opiates in the first place. And maybe now they're in a medicated assisted treatment program called a MAT program, where perhaps they're on a different lesser opiate, less addictive than heroin. As part of that program, they've been requested to do some counseling, to get weekly urine tests, to get certain medications to help them come off the heroin. And at the same time, they may be referred to me for acupuncture assessment from a TCM perspective. So I talk with the patient. Oh, some of these pain points are why you're taking the medication in the first place. So let me address that while keeping in mind the various patterns, the various aspects of what's going on with their body, their mind, their mental state, and put together a treatment program for the patient. Then a patient says, okay, I'm also in this MAT program. I'm trying to slow down on my use of medication. Or their primary said to them, sorry, I'm not going to refill your medication. So what can we do? Sure, we want to treat the underlying conditions and reasons for the patient being on medication in the first place or becoming used to it. And what can we do? Some of the protocols we use, therefore, we're treating the root problem, the reasons they're on the medication, as I said a moment ago. We also may use a specialized protocol, one of which is called NADA. It's a ear treatment protocol. And we're using some points on the ear specifically to assist with some cravings that someone may have. At minimum, you could say this technique is placebo effect, at minimum. Maybe we use needles, our ear seeds rather, patient goes home with. We use these, they press on a point that has an effect on the brain. The vagus nerve travels throughout the ear, having an effect on the organs, the brain. At minimum, you can say with ear seeds, it's a placebo effect, but also actually we're having an effect on the nervous system and help the patient lessen their dependency on medication. So we can do that. If we notice patient has a certain condition, then I contact the primary doctor or the behavioral health team and say, okay, this patient is exhibiting XYZ. Maybe they want to see a counselor. I asked the patient, they said, yeah, let me see a counselor. That counselor becomes part of the team treating, the complete team treating that substance abuse disorder. So in the environment I work in now, I'm therefore part of an integrative team. Could I say I'm just treating on the side, only in my little bubble? No, I'm integrating in a way like the web that Has No Weaver talks about. We're treating that patient as the center of the universe, using those different modalities coming together for a complete picture to treat the patient. Then in a modern world, anyway, we combine a little bit East and West, but fundamentally at the end of the day, I'm still treating the patient as a TCM provider. Treatment coverage for acupuncture, for helping patient with substance abuse issues. Maybe sometimes we're doing herbals, depending on what the patient is taking, their supplements, their medications, the goals of their entire treatment team. This can be paid for through insurance under the Affordable Health Care Act, Medi-Cal, Central California Alliance, authorized acupuncture. There's grants that help pay for the acupuncture for our time. So specifically, so today this exists, is alive at Santa Cruz County Clinic Services Division is where I'm working under an aspect of public health. Then we treat patients at Watsonville, Santa Cruz. HPHP Clinic is Homeless Person Health Project. And so this service we're offering, I have many people come up to me and say, oh, we're so happy you're part of our team. We have patients who say how helpful you are for their anxiety, their stress, their depression, which is a part of the complete picture of a person, a part of issues dealing with substance abuse. Why you see so often treating substance abuse hooked in with behavioral health, treating mental health issues. So even today, I was doing a CPR recertification this morning. 3 of the other doctors in the room said, thank you, Dr. Byrd. Our patients tell us all the time how happy that you are at Santa Cruz Clinics to treat us and offer another modality besides medication, besides the drugs, besides physical therapy, or in addition to physical therapy or other modalities like OMT, osteopathic manipulation. We're so grateful you're here for our patients, and they tell us how happy they are. So I am so happy to be part of TCM community, 5 branches community, where I've taught several years, and to play a part in bringing our medicine within the U.S. healthcare system in a meaningful way. I hope I didn't talk too long, though.
Thank you so much. That was wonderful. That was excellent. Thank you so much, Professor Byrd, and so much to unpack there. I love that. And we'll go right into speaking with Joanna Zhao, who is, of course, the Dean of Five Branches University. Remember, Five Branches began in 1984. We have been around a while, and Joanna is one of our senior professors who taught, I want to say, maybe all of us on this, on the rest of the panels here. So we're so happy that you're here, Dean Joanna, and we want to go ahead and give you the floor. And I'm so pleased to hear what you have to say, your experience treating every day in the clinic. You also have your private clinic as well.
Hi, everybody. My name is Joanna, and I'm happy to talk to you, everybody. And I heard, Dr. Doug Mitchell and Dr. Pa and Nick and Dr. Byrd and then GGO and our president, Ron's talk. I'm really excited to be here. For the opiates problem, it's not a new problem to us. Yeah, it is the problem related with the pain medicine, which is opiates. They mostly treat the pain, and finally they addicted with it, unfortunately. And some of them, of course, they taking by accident and or just to become addicted. So what the Chinese medicine actually talk about, that we call it toxic in the body, right? And I remember when I was studying in China in the TCM Medical School, I have a very good teacher, Dr. Wang, and he always said, you have to remember that human beings have 7 emotions, right? Everybody knows that's even in whoever has no way talk about that. And you can be happiness and sadness, whatever, the 7 emotions. And also the emotion, if not good, it's too excess. And even the happiness will cause trouble too much. So that means called the stagnation, the channel stagnation. That's why it's not good, right? So my teacher always said, the human being body has organs. The organs needs energy, right? And we also have a channels. The channel now, they proved that there's a channel in the body, and the channel needs chi. Chi is the vital energy. Chi, the energy, if you don't have that energy, you can't live. Just like you have blood in your blood vessel, you have nervous system, you have another one, channel system, right? So that's what when I was studying, I always concentrate on that and do the acupuncture and the herbs to help to open Jing, Qi, Shen, which is the body, mind, spirit. We always talk about it. So what is that? In the body, it needs energy. And the Qi is a vital energy, which is you always have to think about, and you're working, and you exercise, what time, you need that energy. And the Shen is the spirit. When the people who has the pain, they take this drug, opiates, and they addicted. How do we make them not addict? And of course, you can use something else, but very fortunately, acupuncture herbs really worked. Gigi, actually, Dr. Berg just talked about the vagus nerve, the ear acupuncture. We use it a lot to help the brain, to open the brain, to open the orifice. And just a few acupuncture on your ear, it works. Even you can have a patient with the ear seeds, little seeds, and stuck in the ear at that point, and you just massage every day, and they feel much calm. The minute they are calm, the pain is little by little eased away. So it's I always say it's amazing, right? Just little needles, small needles, and the little seeds, and make your pain go away. And also another one, opiates, now they just have that as the addiction. So we treat addictions the actually most for the opiates crisis, right? So stop the pain, help them to take less opiates, and stop the crisis. And sometimes they have the crisis like a PTSD type, because they don't want to take it, but they're worried. They're scared if they don't take it, they get more pain. So that is also acupuncture herbs can help. Today, I don't have too much time. If you come to our school, come to my class, come to Dr. Mitchell and everybody else's class, you will learn it. That's very important. You have to learn, then you know what's going on there, right? And then you can help people. That is what we needed to do. Okay, thank you.
That is excellent. Thank you so much, Dean Joanna Zhao. And I wanted to say too, as you were speaking, there was something that came to my mind, which is that we're treating the whole person when we treat with acupuncture, with the herbs and so on. And the idea behind substance abuse is generally that there's not only one thing going on. It's maybe pain from a car accident that started, but many of us do feel a kind of emotional pain, a psychic pain. We're always maybe working with it a little bit. And then when we're in physical pain, it can get worse and worse. So the acupuncture can actually treat body, mind, and spirit. And we combine that with the Western way. And for more on this, we have alum Adriane Dougherty, who is here from her office in, correct me if I'm wrong, there's Media, PA, Allentown, PA, and they're right near Philadelphia. And I actually got a chance to fly out a few years ago and interview her there in her office. She's an acupuncturist, of course. She has her doctorate, and she treats many different patients who struggle with substance abuse. And we'd love to hear from you, Adriane. Please take it away.
Hi. So I definitely have an office in Media as well as in Lancaster, Pennsylvania. And but where I practice, where I treat addiction is actually at a facility in South Jersey. That's an inpatient drug and alcohol rehab. And at that facility, we have an amazing wellness department that I am supervisor of. And in my department, we work really closely with our medical department as well as our clinical department. And it's pretty awesome. I saw that somebody asked how well the ear seeds work on the chat. And so ear seeds is what I do first on all the patients that walk in the door, the ones that are well enough to get out of bed. And the ear seeds are the first thing because they're least invasive, and it allows them to be able to use them as they see fit and as they can. So what ends up happening with them, is that better?
Yes. Can you speak a little bit more into the mic? We want to hear every word. We're hanging on the words. Go ahead.
So with the ear seeds, they're very effective, and it's easy to use them early on in a rehab setting. A lot of the patients are very, very sick. So having them sit through acupuncture is a little bit harder when they first get there, but the ear seeds are not difficult to do. So we use them a lot. And we do a lot of other stuff. There's different stages when you show up to a rehab. So when you first get there, you're fairly sick and going through withdrawal symptoms. So they're medically managed, and then they're all sent to me each day for an hour to help manage anything that medical isn't managing well. And for some people, it could change. So we treat them individually. So some people get topicals for pain, some people get teas for withdrawal symptoms. So we provide a bunch of different services, as well as acupuncture, massage, yoga. We the patients who are feeling a little bit better in our residential program for a little bit more long term, we take them outside. We teach them meditation. We do qigong. We do we have a labyrinth outside. We take them outside and make them yell at the trees to let go of some anger. So like we do a lot of different stuff with the patients according to their level of functioning. And so I know that both Jacquelyn and Joanna both talked about the NADA protocol and the ear things. I do all of that as well. I'm not going to repeat all their information, but the biggest thing with patients coming into rehab trying to get off of opioids is the withdrawal part of it. That's the hardest part for them to get over. And then as soon as that part's over, then the emotional stuff comes in. And so in my department, we get the opportunity to actually treat the whole body, like you said, mind, body, and spirit, and we treat it all. So we do essential oils in the rooms, and we do, we have like biomats, and we have all these different things, and a zero gravity chair. So we try to come at it from all different angles, but also according to what the patients can actually physically handle at that moment when they're withdrawing from drugs and alcohol. And so it's pretty amazing, and it's very effective. And I think that it's underutilized definitely in facilities like mine, as well as I think other acupuncturists. I know in my private practice, no one seeks me out for any type of addiction treatment outside of the rehab. And I think it's just because maybe accessibility, maybe money, maybe knowledge. I'm not sure what it all is, but it definitely is underutilized in my private practice, and not for lack of advertising or any of that.
Yeah.
So,
And we do have a question for you, Adrian, and then I'll go on with a question for Joanna and Jacquelyn. Is it a private facility or is it state funded?
So it was a nonprofit up until 2 years ago, and now it is privately owned for profit, but it does accept Medicaid currently. So there's a little bit of everything happening there right now, but it's one of the most amazing facilities. I am not just because I work there and I love it there, but the things that they provide, it's on 44 acres. We provide, we have a full gym and cardio room. We provide yoga. We do art therapy, music therapy, drumming circles. We provide so much stuff.
Very nice.
All of it plays a huge role in healing. But the acupuncture and the Chinese medicine is what they get first during their sickest times. And then I focus on chronic pain after. So anybody that comes in with an addiction to pain meds because of chronic pain, then I deal with them 4 or 5 times a week with different modalities and through acupuncture and Chinese medicine to focus on their pain management, because they won't get pain meds. They won't get anything that's helpful from medical. So
that's so interesting. Yeah, absolutely. So you're there for them in their sickest times and the hardest times that they're withdrawing and really going through it. And you're there. Yeah, that's fantastic. We had a question earlier, and I want to direct this to Dean Joanna Zhao. We're wondering about what do you notice when you use the acupuncture and the herbs in terms of people not relapsing? So how does it help people to stay away from the substances, the acupuncture and the herbs as well?
Yeah, okay. So when I'm treating patients, for a patient who has addiction, doesn't matter what addict, okay, can be even alcohol.
Yeah.
Many of them.
Yeah.
Most of them, they want to have this addiction because they're nervous. You can tell because their life is a bit, off. Sometimes they want to enjoy, but most of the time I found out that they have some stress, anxiety, and some other problems. So that's why they want it. So when we do the acupuncture, give the herbs and even just first treatment, after treatment, they feel so good. Once I went into the clinic room, I tried to take off the needles. The guy would say, "How do you get into my room?" I said, "Well, you are in my clinic." That means that, he's totally relaxed, right?
Yep.
So I think most of them, they actually benefited from the acupuncture treatment. Not too many come back say, "Oh, I don't feel good." I don't see that. So that's why the channel energy is working there, and with the herbs too in acupuncture. Yeah, I don't know if I answer your question half of.
Oh yeah, absolutely, absolutely. And final thoughts from our panelists. Anybody, Dr. Byrd or Joanna Chao, Dr. Chao, or Dr. Adriane Dougherty. I'm so happy to see all of you. It's been my pleasure. And if anybody would like a final thought,
yeah, I just want to say one thing. And actually, before the pandemic, now we still come back. Many of the Central California airline patients, they send a patient to us. For a while, we have 100 patients a day, and we have so many we can't even finish, right? So acupuncture really welcomed by these patients and the doctors who refer to us. Yeah.
Absolutely. Absolutely. And thank you so much. And I've been told also to mention right here, right now, that that we do have the raffle for the physical hard copy of The Web That Has No Weaver. And there's a code that our IT fellow has mentioned to me, of course, and he organized this whole event as well. 5 Branches Webinar. 3 different words, 5 Branches Webinar is the code for when you put that in to get your, to be entered in a raffle. There's 10 physical hard copies, and we're going to mail one of those out to you if you win. And we so look forward to it. And now we're going to go right into our final panel. This is so exciting. And we will, just as President Ron Zaidman said, we will do more of these. We might have an ongoing discussion about The Web That Has No Weaver. There's a lot more to say about